Hi, I'm Rick, Vice President of Operations for Heritage Victor Valley Medical Group. This video is just a quick summary of the previous ones, why you would want to choose a Medicare Advantage health plan versus staying on straight Medicare, and highlight the benefits available to you that a medical group brings. Quick review of the hierarchy. Remember, Center for Medicare, Medicaid, or the federal government contracts with each of these health plans. The health plans contract with medical groups such as Heritage, and Heritage or the medical group contracts with the physicians and other providers that are presented to you for your healthcare needs. Really, there are four major reasons, I would say, to choose a Medicare Advantage health plan over staying on regular straight Medicare. Additional benefits. Again, for these health plans to participate, they must offer the same benefits as regular Medicare or more, so of course they offer more. Lower cost to you, a higher quality of care for you, and then local representation. And the additional benefits that you receive under a Medicare Advantage health plan, again, you get your core Medicare benefits, but they do things such as vision, dental, non-emergent transportation, maybe gym memberships, additional health education, hearing aids, things that are not offered under traditional straight Medicare. Cost, if you remember, I talked about cost of straight Medicare, such as a $1,340 inpatient hospital Part A deductible that you pay under straight Medicare. Almost every Medicare Advantage health plan, if you have an inpatient encounter, will be at a zero cost to you. Part B is employee benefits, which are going to your physician visits, whether it's specialist or primary care, laboratories, radiology, emergency room visits, those kind of things. Regular Medicare, you're going to end up paying 20% of what Medicare allows for those services. And if you think about an emergency room visit, that could literally be hundreds of dollars. Under a Medicare Advantage health plan, you're typically going to have a zero or a very small copay for any physician visit. You probably have zero copay or no cost at all for radiology or laboratory services. And emergency room visits are a comparison point for you to shop from plan to plan. Some of them will charge you $100 for copay. Some of them will be more, a little bit less. So this is a comparison point for you as a shopper of healthcare. What plan offers, what benefit, and what it costs to me when I'm looking this time of year. Another big one that you can compare from plan to plan are skilled nursing visits. Sometimes you come out of the hospital and they put you in a skilled nursing facility for a number of days. Again, the Medicare benefit, straight Medicare, is no cost to you for skilled nursing facility from day 1 until day 20. So that's the same under any of the Medicare Advantage health plans you want to choose from. Day 20 to day 100 can be the difference. Some of them will charge you $100 a day for day 20 to day 100. Some of them will say something like from day 20 to day 50 it's $100, and after day 50 it's zero, or the numbers change. So again, a consumer of healthcare, this is a shopping point, a point of comparison for you from plan to plan to plan as you're looking at different benefits available to you during this time of year. A lot of cost under regular Medicare, again, 20%. Durable medical equipment, 20% of those costs. Most of those are going to be at no cost to you under a Medicare Advantage health plan. Now, quality of care is another big part of it. There are things available to you under a Medicare Advantage health plan through your medical group assignment and affiliation that you would not have under straight Medicare. We have a whole team of folks at the medical group level that are in case management, that are in care coordination. They will assist your physicians with things such as preparing you for a surgery, and also we do things after the surgery called discharge planning or transitional care. We will discuss with you as soon as you're discharged the medications that you were on and before you were in the hospital, and then also what was newly prescribed for you from physicians you met while you were in the hospital. Sometimes we'll find duplications and prevent things that could be harmful. We had a gentleman that had a high blood pressure medication that he was not taking. Then he had a cardiac event, was hospitalized. While he was in a hospital, a physician wrote him a prescription that was basically the same one he already had at home. He goes home and he says, oh, now I'm going to do what I was supposed to do all along, and I'm going to take that medication I already had, plus the new one. If we had not had a nurse talk to him within 24 hours of getting home and determining that he's really taking two medications that had two different names but were really the same kind of medication, he would have had another problem and probably gone back to the hospital for maybe low blood pressure, taking two high blood pressure medications. So we do medication reconciliation. We assist helping you get specialist appointments. When you come out of the hospital, oftentimes you'll have a new specialist that you're going to work with to help you recover for that condition. We have a pharmacist available at the medical group level that collaborates with your physicians. We have health educators. This is big for a diabetic population. Oftentimes we can help you prepare for a surgery ahead of time by getting that blood sugar level down, by working with a health educator and our pharmacist who are collaborating with your physician, get you better prepared for that surgery and have a better outcome. Local representation. When you choose a Medicare Advantage plan, of course you can call a member services representative at the health plan, and you also can call representatives at the medical group level. Now these folks are usually local in your community and very, very familiar with the network of physicians and other providers that are available to you that you're working with. If you think about it, on regular Medicare, you can turn over that red, white, and blue card and see an 800 number, and you'll call somebody called an ombudsman. They might be in another state, they may even be out of the country. They're not going to be in touch with the providers in your community and all of those healthcare providers that you are dealing with on a daily basis. So better representation. Again, more benefits, lower costs, higher quality of care, and local representation. All things available to you if you choose a Medicare Advantage health plan versus remaining on straight Medicare fee-for-service. So be good consumers of healthcare this year. Go to a meeting, learn a little bit more about the benefits available to you. There are no obligations. It's an educational opportunity for you. Compare health plan to health plan to health plan. Figure out what costs are available and more beneficial to you under which plan, and make sound decisions for your health care coming up in the next year.